It's an extraordinary achievement. After 8 days of staying at home, a Delta outbreak in southeast Queensland appears to be in check. Despite 7 new cases linked to the Brisbane schools cluster, the lockdown ended this afternoon. But as we regain some of our freedoms, a new infection in far north Queensland has plunged Cairns into lockdown. We'll go to Cairns in a moment, but we begin our coverage with Talissa Saganto in Brisbane.
Lockdown lifted.
Great to be out and about now. Thanks a lot.
Freedom for millions who'd been bound by strict stay-at-home orders for the past 8 days.
Excellent result for southeast Queensland, one I truly wasn't expecting.
The good news was announced not long after the Premier was released from her own 14-day stay in hotel quarantine.
I'm very proud of the work that everyone has done. This is incredible.
It comes after the state recorded 9 new locally acquired cases, 7 linked to the Indooroopilly High School cluster, 1 on the Gold Coast and another in Cairns, both under investigation. Testing at this Robina clinic has ramped up. Yesterday, a total of 26,000 people were swabbed, but officials are quietly confident the 11 LGAs have dodged Delta.
After we had those very large numbers of early cases, to see it under control so beautifully is fantastic.
But restrictions remain for at least another 2 weeks, including mandatory masks and a plea from authorities to delay regional travel. From today, only 10 people will be allowed in homes. Weddings and funerals will be capped at 20 attendees. While non-essential businesses can reopen, customer numbers will be reduced. Ticketed and seated events will return at 50% capacity, but community sport will remain cancelled. From tomorrow, most students can return to the classroom, except for those still under home quarantine orders. But for the first time, high school students and all staff at schools and childcare centres will have to wear a mask.
But primary school students at this stage will be voluntary.
Access to vaccines has increased, with more people now eligible.
If you are working in childcare or you are working in a school, if you are a fly-in or fly-out worker, or if you work in a distribution centre.
While many will be out celebrating tonight, almost 12,000 people are still in home isolation, where they'll have to stay for a number of days.
These people are our first and last line of defence. It is absolutely crucial that if you are given a home quarantine direction order, you must follow that order.
Talissa Saganto, ABC News, Brisbane.
Well, with lockdown lifted in the southeast, many restaurants are trading tonight. Jessica Ross is in Milton. Jess, what's the feeling there?
Well, Jess, there's relief mixed with caution tonight. Restaurant owners are happy to say goodbye to the lockdown and hello again to their loyal customers who have made bookings tonight. Indoors, they must still stick to the 1 person per 4 square metre rule, so numbers are capped, but at least customers can dine in. The ABC did speak to a few operators who were concerned about reopening. They felt it could be still too soon in case there were any cases in the community. But the Premier has also said these snap lockdowns will continue whenever and wherever there are outbreaks. So while southeast Queenslanders have been given a reprieve, we're not out of the woods just yet.
Jessica Ross, thank you. Well, let's go to far north Queensland now, and tonight more than 170,000 people in Cairns and the Indigenous community of Yarrabah are in lockdown. Authorities hope a 3-day shutdown will be enough to curb any outbreak. A taxi driver has tested positive to COVID and has been infectious in the community for 10 days. Christy Sexton-McGrath reports from Cairns.
Gearing up for a big testing push. Pop-up clinics have been set up amid concern on the streets of Cairns.
I'm actually very stressed and paranoid right now.
This comes as a complete shock to me.
A taxi driver has tested positive, infectious in the community for 10 days. Others in his household also have symptoms.
So there is a real risk this could already have spread. which is why from 4 p.m. today we need to go into lockdown.
Until 4 p.m. Wednesday, those in Cairns and Yarrabah can only leave home for groceries or medicine, essential work that can't be done from home, exercise within 10 kilometres of home, and healthcare, including a COVID test or vaccination.
Let's test as much as we possibly can. We need to get on top of this very, very quickly.
Only 2 visitors are allowed in homes, 20 people at weddings and funerals, and masks must be worn in and outdoors. Schools will only be open for children of essential workers. Restaurant owners are reeling.
I've got to organise a lot of stuff, so a bit sort of overwhelmed, I guess.
Unfortunately, this will cause a lot of damage to a lot of businesses.
A support package is in the works. This infection was unexpected. It's not clear how he contracted the virus. Genome sequencing should shed light on that. The last positive case in Cairns was a reef pilot 5 days ago. The taxi driver was on shift from the 31st of July to the 4th of August and visited several places around the city. Contact tracing is underway as one of North Queensland's biggest cities shuts down.
I know you can do this. I know it's going to be tough.
We have to roll with the punches. There's only one way to stop this.
They hope 3 days will be enough.
And Christy Sexton-McGrath joins us now from Cairns. Christy, how's the city coping with this news tonight?
Well, good evening, Jess. I'm outside the Cairns COVID testing clinic, which is open until 10 o'clock tonight. There's a big push on here for people to get tested. We saw some pretty big crowds on the Cairns Esplanade today at a pop-up testing clinic. People are really worried about the situation. I spoke to a taxi driver who said that he was terrified. So Queensland Health is urging residents to keep an eye on that list of exposure sites. Tonight, they include a Woolworths at Menunda, as well as the Brothers Leagues Club and a 24-hour medical centre in the city. And Jess, that list of exposure sites is expected to grow.
Thanks for the update, Christy Sexton-McGrath in Cairns.